Hello, my name is Ian McCall, and this is the first of the webinars or videos on oral medicine for dental students. I'm a dermatologist. I'm interested in dentistry simply because my daughter is finishing dentistry this year, and as part of the preparation for exams, I thought I'd go over some of the areas in which dermatology and dentistry overlap. These are the various conditions that we're going to look at, and we'll do a video on each one of them. But tonight I'm going to look at, first of all, the issue of a dry mouth. Now, certainly anything that reduces saliva will cause a significant increase in dental caries. And one of the main medical conditions that will cause a dry mouth is Sjogren syndrome. So tonight we're going to have a little chat about that. Let's just have a look at some of these images. This was one of my patients with Sjogren's, and here she's presenting with gingivitis. Now you might look at that and say, look, there's a fair bit of obvious saliva there. But in point of fact, she had a little bottle of water with her, and she was drinking all the time. So it tells you a little bit about Sjogren's, an autoimmune disease that affects a variety of exocrine glands throughout the body, but primarily those in the skin and in the salivary gland. And when it affects the salivary gland, there's reduced saliva, and as dental students, you'll know that when you have a dry mouth, you get all sorts of problems, but primarily an increased risk of caries and increased risk of gingivitis as well. This lady, you can see, has a little bit of a pallor on the surface of the vermilion surface of her lips as well. And this may be leukoplakia, perhaps, also with early actinic damage. There are other causes, though, of a dry mouth. And the combination of dry eyes and dry mouth, and these are some of them. Aging. As you get older, you tend to get less of a salivary secretion from your salivary glands. Diabetes gives rise to a dry mouth. There's a neuropathy often associated with that. Hepatitis C can give rise to a dry mouth. Now, I don't know why that happens. I'd suggest you look that up. AIDS patients, they tend to have a dry mouth as well. Now, again, I'm not 100% sure why that happens unless they have some underlying salivary disease. Parkinson's, another problem. They have excess sebaceous secretion, though, and often, in fact, it's seborrheic dermatitis, but apparently they're susceptible to a dry mouth. Some of the drugs, by the way, that are used in Parkinson's disease, I think that's their anticholinergic drugs, and I think they're the reason why they have the dry mouth. Radiotherapy. If you have any radiotherapy involving the salivary areas, the parotid gland or the submandibular glands, then radiotherapy will damage those glands, and so there'll be a reduced secretion. So patients who have radiotherapy in this area will have dental problems afterwards. Sarcoidosis, chronic granulomatous disease, it can infiltrate parotid glands. So it can damage them in that way and give you reduced saliva. Graft versus host disease, this is where you've had a transplant of some kind and you're on drugs, and then your immune system reacts against the transplant. And part of that immune attack can involve the oral cavity as well. And it gives a picture like lichen planus in the inside of the mouth with ulcers and necrotic sloughing mucosa. But it can give rise to a dry mouth. And then there's the various drugs that can give rise to dry mouth. Antidepressants, they have anticholinergic effects. They'll give it. Some of the antihistamines, not all of them, but some of them will give rise to a dry mouth as well. Some of the antipsychotics. Incontinence medications, these are usually acetylcholine inhibitors, and they're there to try and stop the bladder emptying, so that it paralyzes the nerves to the bladder. But one of the problems is it also affects the Same parasympathetic nerves that affect the secretions in the inside of the mouth, so patients get a dry mouth with those as well. Isotretinoin, primarily that affects grease glands on the skin. It's used in acne, but it can give rise to a bit of a dry mouth, and diuretics, just by drying you out, presumably can give rise to a dry mouth. So these are some of the other reasons why someone may have a dry mouth. Sjogren's disease is also one of those conditions. So what do we know about Sjogren's? Sjogren must have been Danish, I would have thought, with a name like that. He first described this disease. Usually these patients are going to present with dry eyes, dry mouth, and perhaps salivary gland enlargement. They can get episodic swelling of their salivary, their parotid glands. Now, if you see a patient with that, you may think that they've got a salivary duct stone for some reason, and they could. It's one of the common reasons for salivary gland, intermittent salivary gland enlargement, but Sjogren's is another one of them. Note here, and by the way, this information is courtesy of Dr. Han Nugent, I think from Tufts University. 90% of cases are in women, and there's a bimodal distribution. There's a child-bearing period in the mid-30s and postmenopausal. So there's two age groups are going to get it, mainly women. Look at that, 90% women. And it's the second most common rheumatological disorder behind lupus. So Sjogren's is fairly common. Estimated 1 to 2 million people in the US. Now that's a population of, I think, about 260, 270 million. 1 in 500 adults, 0.5% of women, and 10 to 30% of them, if they have autoimmune connective tissue disease, they'll suffer from secondary Sjogren's. Now, secondary Sjogren's is a combination of Sjogren's and some other connective tissue disease, such as lupus or rheumatoid arthritis. So Sjogren, occasionally even dermatomyositis, or scleroderma. These are all other autoimmune diseases, and you can get mixed connective tissue diseases, with Sjogren's being part of it. So some are primary Sjogren's, others are secondary to other, seen with other autoimmune diseases. These are the various factors that you have to take into consideration when you're thinking of Sjogren's. Ocular symptoms, you get eyes that aren't producing normal ocular secretions. They're going to get dry, they're going to get irritable. You get a red eye. You may rub around the skin there as well. You may get a low-grade dermatitis around the eyes from the rubbing because they're irritated. Oral symptoms, dry mouth, difficulty swallowing. You need saliva to be able to swallow properly. So they'll have difficulty swallowing, dry mouth, dry lips. Ocular signs. Well, we've talked there about the dry eyes, reduction in tears. And these are tests. The Schirmer's test is where you have absorbent material that's put, strips that are put in both eyes, and you see how between the conjunctival surface and the scleral surface laterally, and you see to what extent they become wet with tears, and they're certainly reduced in patients with Sjogren's. Diagnostic histopathology features in salivary gland biopsies. Well, if you take a biopsy, say, of the salivary glands in the lower lip, then what you'll see is lymphocytes around the salivary acini, that's the ducts, and where the glands are. The lymphocytes are attacking the salivary glands, destroying them and reducing the saliva. Presence of or an abnormality in at least one salivary gland study. Now, these are the studies. Sialography is where you inject a form of radiopaque dye into the opening of the parotid gland. And you can then see a picture of how the salivary gland looks. And we'll show you that just a minute. And then the presence of at least one of these antibodies, Rho or SSA. These are extractable nuclear antigens. They're common in autoimmune diseases, and they particularly cause photosensitivity. You've got high levels of that little low, then you'll be photosensitive. You'll be more susceptible to getting a rash in sun-exposed areas. And the other little thing about these is they'll cross a placenta. And if you've got a woman with Sjogren's who's pregnant, and who maybe, if she's got highest levels of these antibodies, they can cross the placenta because they're IgG. They can attack the fetus, and they'll attack the conduction tissue of the fetus and the heart. And the baby can be born with congenital heart block. And also, if the baby is then put out in the sun, because these are photosensitizing antibodies, these maternal antibodies can cause the child to get an annular rash on the face. And similarly, of course, patients with Sjogren's who have this, they can get photosensitivity rashes, and they can get other sort of skin rashes as well, including purpura. This is where there's damage to little blood vessels and leakage in the skin. They can get urticaria or hives, again because of these antibodies interacting with mast cells and releasing histamine, giving hives. And they'll get dry skin as well because of the involvement of the exocrine glands, so they can get dry, flaky skin. Anti-nuclear antibodies, ANA, these are the things that are raised in lupus, but they're raised in many of the other autoimmune diseases. And it's a speckled titer of antibodies, speckled titer, a high titer of speckled antibodies. And rheumatoid factor, because see, a lot of these patients with Sjogren's, they also have rheumatoid arthritis as well. So they find their way to rheumatologists. So they've often got a positive rheumatoid factor. So these are the antibodies, these are the photosensitizing antibodies, these are the anti-nuclear antibodies that may be seen with associated lupus and positive rheumatoid factor if they happen to have associated rheumatoid arthritis. Exclusion, pre-existing lymphoma, AIDS, sarcoidosis, chronic GVH, okay, because they're going to involve the salivary glands, so you kind of they're going to damage them anyway, so you can't use that as a diagnostic criterion. Then, 4 of these 6 criteria for primary Sjogren's, 3 out of 6 for probable primary, secondary, 1 or 2 plus 2 of 3, 4, or 5, other associated diseases. So, these, you can see it's a syndrome. In other words, it's not just one thing. You have to have a variety of these things together to make a syndrome. Note that Sjogren's doesn't just involve the salivary glands. From your point of view as a dentist, that's what you're mainly concerned about. But it involves some of these exocrine secretions in the lungs. So they get reduced mucus, so they get chronic bronchitis. Damage to the lungs can affect some of these areas in the gut as well. I think it can also affect exocrine pancreas, so they may have difficulty breaking down fats. These are the various features in the skin that we were talking about. Raynaud's, by the way, is where you get spasm of the little blood vessels affecting the fingers, and the fingers go white initially, and then they go blue, and then they go back to normal color. And it's particularly seen in the cold, obviously, where you get vasospasm, but it's seen in patients with scleroderma. That's classic who'll get Raynaud's. Vasculitis, as I say, is inflammation of blood vessels. If you get immune complexes here that are deposited in blood vessels in Sjogren's, then patients can present with purpura, usually acral, around the ankles and areas like that. And then look at the neurological features of Sjogren's as well. Central peripheral neuropathy and depression. So you see, Sjogren's doesn't just affect the mouth, but affects a whole lot of other areas as well. And this was just the classifications. Primary, systemic autoimmune disorder of the exocrine glands, no associated connective tissue disorder, and they're quite severe, the Zika complex, so they really get dry mouths. And then the secondary one, the other 50%, all the symptoms of primary plus some other autoimmune disease. And they're saying it's usually rheumatoid arthritis. But you can have lupus, you can have scleroderma, I think you can even have dermatomyositis mixed with it. And that one, less severe Zika or dryness features and milder ocular symptoms. But look at the other thing with Sjogren's, increased risk of, they're saying pseudolymphomas, but other lymphomas like Hodgkin's can develop in these patients, and also cancer of salivary glands. The autoimmune attack on the salivary glands makes them at greater risk of developing malignancy. There's some other oral features of Sjogren's that you might see, dry mouth, dry tongue, loss of the filiform papillae. There's the normal surface there with the filiform papillae in the surface of the tongue. Look at that glazed tongue. I mean, if I was to see that, what else would I think about? I think about vitamin B12 deficiency. You know, as an alcoholic, they'll get a glazed tongue like this as well. But it's a feature of Sjogren's. What else have we got? Treatment. Well, you know that they have to drink quite a bit. If they don't drink quite a bit, they're going to be in trouble. You try and stimulate the saliva, you know, hard candy. It's obviously American for the use of that term. Hard lollies, we would have said, or sweeties. You suck them, and that tends to increase your secretion. Pilocarpine is a drug that stimulates, acetylcholine stimulates the nerve endings and will increase saliva. This is a cholinergic agent here, cevimeline. Don't know that one. Special toothpastes. You know, you've got to have extra fluoride and the like if you're going to have a dry mouth because of that increased risk of caries. And very good dental care. These patients have to be seen regularly by the dental hygienist. You've got to make sure they don't develop, you know, periodontitis, other gingival disease. Try and reduce their carie formation. They have to be seen really regularly, and that's very important. These are just some treatments for the dry eyes and saline nasal sprays. There was a couple of other, this is my last thing. Yeah, here were some other symptoms that you get with Sjogren's that you should know about. Burning of the mouth, this is what the patient may present about. And sometimes atypical thrush. You know, with that dry mouth, it's more that you don't have the normal bacterial, the antiseptic effects of saliva. So you're more likely to get mouth infections, especially Candida. So watch your patient's got dry mouth with atypical thrush. Patient has difficulty chewing. Dysphonia just means difficulty of speaking. Again, because that lack of saliva can give you a dry throat. Inability to spit. We've talked about that. Yeah, you're waking up at night to drink water. So if your patient's telling you you're getting up several times during the night with a dry mouth, I mean, that can be because of nasal blockage. They may be snorers. They may get a dry mouth because of that. And then pain with spicy or salty foods. And sialadenitis, that's inflammation just of salivary glands, painful salivary glands. And then these other problems in the throat, difficulty swallowing, especially with dry foods, dry nose, giving you nosebleeds, and hoarseness. We've already said that's related to the dysphonia with dryness. But a couple of other nice little websites I wanted to bring out to you. Let me show you, was it this one? Yeah, this is another website there. It's called Dentistry and Medicine. God bless them, they've got a series of adverts at the beginning that you really don't want to know about. But they've got a nice case in there of a patient with Sjogren's, a big thing here about Sjogren's as well. So if you have a look at that, dentistryandmedicine.blogspot.com. And this is sialography. There's that picture of dye being put in the salivary glands. And this, can you see this picture? It's not big enough. I got it from somewhere else. This is supposed to be the snowstorm effect that you see in the salivary gland with pooling of the dye, and that apparently is highly specific for Sjogren's. This patient, I don't know, is that meant to show some swelling of the parotid glands there? See that? They sometimes get a bit of swelling like that. And the other image they had here was where they did a biopsy. You know, they just did a punch biopsy, or a little incisional biopsy of the lower lip here, because you get salivary glands there. You can see the autoimmune attack there. And this was these are lymphocytes around the acini, the ducts. Your salivary ducts here is part of the inflammatory process that you get with the pathology of Sjogren's. And the other website I wanted to show you was this one. It's just a nice little thing here on understanding the complexity of Sjogren's. And I think it was written by, this was mainly for dental assistants. But it's a nice, I went through it, it's a nice little discussion of Sjogren's. And it, you know, if you read through it, I think it'll help to enhance some of the things that I've already said. They had a nice little treatment down here. Where was this? Yeah, the discomfort of dry mouth causes many patients to drink large amounts of high sugar beverages. Well, that just makes things worse. You know, the sugar makes the caries worse. They have to use sugar-free hard candy and chewing gum to relieve the discomfort. A home remedy that they can be used that's useful, mixing essence of lemon and citric acid in glycerin has provided relief for many hours. Mixing essence of lemon and citric acid in glycerin has provided relief for many hours. Well, that might be useful. And watch for the changes in the parotid gland. Remember we said there was an increase in parotid carcinoma. Watch for that. And there's a few Sjogren's disease support groups that you really should be aware of as well. But this was a good little article, I thought. So worthwhile having a little look at that website as well, and have a little read through it. You'll learn a bit more about Sjogren's. So let me go back here. I hope you found that of some interest. Sjogren's is important. There's a lot of patients out there who've got it. And it just goes to show you the importance of saliva in preventing dental caries and dental disease in general. So anything that causes a dry mouth will cause the patient to seek dental care. And remember, this was a differential diagnosis of dry eyes and mouth. These were some of the other conditions that can give rise to a dry mouth as well. So if you get a short question on Sjogren's or in a dry mouth, you should know it's not just Sjogren's, but some of these other things that play a part. So remember the drugs, okay? And remember some of these other conditions: graft versus host, sarcoid invading the salivary glands, head and neck radiation therapy, the radiation destroying them, a little bit about Parkinson's. Read up about Hep C and AIDS as to how that reduces saliva. Diabetes, just getting old. We all reduce our saliva as we get older, so we're more susceptible to dental caries because of that. Okay, we'll get on to one of the other topics for our next lecture. Thanks very much.